Hi, I'm Dr. Mark King from the Motion Palpation Institute. I'm the current president at MPI, and I'm in private practice in Cincinnati, Ohio, in the United States. Today, I'm here to talk about the report of findings and the importance of this and how this is a really important step in your patient care. So I kind of obsess about the idea of categorizing your patient. So this is one of the things that MDT, McKenzie, Mechanical Diagnosis and Treatment, this is one of the things they do a really good job. They try and categorize their patient. And in MPI, we do a similar thing. We have a little bit different categories, but the point is we still put them in a category, so then our treatment is more specific and more helpful for our patients. So the categories are, of course, the first thing is bad stuff. Do they have a big problem that needs emergency care? They have a spinal infection, they have a fracture, stuff that is not what you should be treating right now. So bad stuff is, we have to eliminate that. That's part of being a doctor. Okay, so we've gotten that taken care of. Let's say they don't have something like that. Then I talk about, is the patient too stiff? Are the joints too stiff? The muscles too shortened? Are they functionally weak, unable to stabilize the joint to allow them to move freely without hurting themselves? Biochemistry is a big factor. Those patients, of course, don't respond as well to your manual care as the stiff patients do and the weak patients do. And then, of course, there's always an other category, and that might be things like poor sleep. That might be stress that they're not managing well. It might have something to do with ergonomics and postural stress. You get the idea. So bad stuff, too stiff, too functionally weak, the biochemistry or nutrition piece, and then other. And just to touch on the biochemistry again, some of these patients, the example I always use is if you had a diabetic, do they heal as well as a non-diabetic? And we all know the answer is no. So if someone's in a pre-diabetic state, in a pro-inflammatory state, as Dr. Seaman would talk about, they're not going to heal as well. So those people are not going to do as well with your manual care. So you need to address that piece. With your treatment, you have to address their diet and supplements. The area that's too stiff, obviously we're going to do our adjustments. We can stretch, shorten muscles, mobilize areas that need to be mobilized. Functional instability, functional weakness, those are more our rehab patients, right? Those are the patients that we need to focus more on rehab and less on adjusting. So I put them in that category, then I know which category to focus on. Now, obviously a lot of my patients overlap. They might be too stiff here, they might be too weak there, and maybe they have a terrible diet. So you can see they can be overlapped. Sometimes people are dominantly in one category or another, and a lot of people are in multiple categories. So keep that in mind. One of the things I always want to talk about is the idea of a care plan. So maybe I see a patient for whatever, lumbar disc, and I have models around so I can show them what a disc herniation looks like and explain it. But maybe they have a disc herniation with radicular pain and we're going to put them on a treatment plan. I might put them on a treatment plan for 3 times a week for 3 or 4 weeks. The point I'm getting at here is they need to be on a plan. I always use the analogy that if someone goes to an oncologist because they have some form of cancer and the oncologist doesn't put them on a plan, they would be very distressed. They want to be on a plan. They want to say, okay, this is what we're going to do going forward. People that are not on a care plan, that first of all, they don't get better, because most people that come to your office have a significant problem, both pain-wise and function-wise. So they don't get better, they don't come back, and they don't refer anybody else because, again, they didn't get results. You treated him a couple times. I always use the example, he's a 50-year-old physically active worker. Let's say he does construction, for example. He's 50 years old, he's had low back pain for 5 years, he's had right shoulder pain for 5 years. That guy's not getting better with 2 or 3 treatments. He needs to be on a plan and go forward. Yes, your care plan will be less for a young person who has a minor injury, but it has to be a real plan either way, and a more aggressive plan as they have more involvement with, like I say, a lumbar disc syndrome or whatever the significant problem might be. I keep other models around, shoulders, knees, I have feet. Then patients also learn that you treat other things besides just spine-related stuff. So the big thing I want to emphasize here is put your patient in a category so you have the right treatment. Explain it to them. If they have x-rays or MRIs, show it to them, explain it, draw for them, make sure they know what make sure they know that you know what's going on. One of the lines, because I've been in practice so long, I say to patients a lot is, this is something I treat all the time, because that's the truth. Now, if I was brand new in practice, I might tweak that a little and say, this is something that chiropractors treat all the time, which would also be true in most cases. If someone comes in with plantar fasciitis, I see that pretty routinely. Chiropractors see that pretty routinely. Maybe you're new in practice and haven't seen many cases of that, but you do know how to treat it from your schooling, and you can say that chiropractors treat that a lot. So anyway, categorize them and then put them on a care plan. You'll get better clinical results, you'll get more referrals, and you'll help build a better practice. Thank you.